Warfarin. What is it for? If you have been fitted with a mechanical aortic valve during surgery, the surfaces of the valve must be protected from blood clots forming on them and in the crevices, which would interfere with the working of the valve. Clots can also pass to the brain, causing a stroke. Therefore, when you have a mechanical aortic valve, you must take warfarin for life. Other anticoagulants, sometimes called direct oral anticoagulants or DOACs, are not suitable for this use. Anticoagulants are sometimes known as blood thinners. Vitamin K in your blood helps it to clot. Warfarin works by interfering with the production of vitamin K. Warfarin may also be prescribed if you experience atrial fibrillation, AF, after your dissection or surgery to reduce the risk of stroke. What tests do I need? You will need regular blood tests to check how much warfarin you need. These are done at your doctor's office or designated lab. These checks are needed to ensure your blood remains in an acceptable range for clotting. This is measured by the INR, or International Normal Ratio. If your INR is not high enough, your blood will clot too much and risk affecting your valve or causing other problems. If your INR is too high, your blood will not clot enough and may cause excessive bleeding if you cut yourself. Normal blood has an INR of 1.0. For most modern aortic valves, the recommended INR range is 2.0 to 3.0. In some cases, an INR range of 2.5 to 3.5 is recommended. If you do not have a mechanical, aortic, or other valve, but you have another reason to need anticoagulation, such as you experience atrial fibrillation, you may be prescribed a direct oral anticoagulant, or DOAC. DOACs also need careful management but require less testing. If you have questions on this, talk to your primary care physician, PCP. It is important to minimize the time that your INR is out of range. It is particularly important not to go below the lower number for long. If this happens, your doctor or pharmacist should increase your warfarin dose and call you back for a recheck around 3 days later to ensure that the increased dose is effective. If your INR is too low for any length of time, you may need to have injections of another anticoagulant, heparin, until your INR is back in the recommended range. What else do I need to know? Make sure you tell anyone treating you, such as your PCP, your dentist, a pharmacist, or a paramedic, that you're taking warfarin. Some people choose to wear a medical alert bracelet or tag to notify healthcare professionals that they are on warfarin. Always check before taking any new medication because some medications can affect the way that warfarin works and can change your INR. Alcohol can also affect the level of warfarin in your blood, so it is important to ensure you drink within recommended guidelines and avoid excessive amounts, particularly binge drinking. Talk to your doctor, pharmacist, or nurse for advice. Home testing. It is possible to test your own INR at home using a coag check device. This is done in conjunction with your doctor or lab. You test your own blood and phone in your INR result, after which you are told of any change in warfarin dosage and when you should next check your blood. Home testing is a great advantage when access to your lab is difficult. It also allows you to continue testing your blood when you go away on a trip. Using the home testing device requires training and a supply of testing strips. Ask your doctor or nurse whether they think this would be possible for you. Further information can be found in the resources section at the end of this patient guide.